I want to talk about prostate cancer, okay? Because that's one of the main fears that all of us have in this room. We all fear that the doctor is going to tell us that our PSA is abnormal. There has been a lot of confusion in the medical literature telling you whether or not you should get a PSA or not. By the way, PSA means prostatic specific antigen, PSA. And I need to recommend to you, now this is my personal recommendation, and my personal recommendation is based on my experiences. I look at what the literature tells me, but I also have to infuse my experience as a family doctor who's been practicing for about 36 years, taking care of a lot of African American men. By the way, my practice is mostly African American men. If you walk in my office, you are more likely to be in there with a bunch of men as opposed to women. I do have women, but I have a lot of African American men. All right? So the PSA, this is Dr. Bell's recommendation. I think that as an African American male, you should start getting your PSA annually starting at age 40. The current recommendations say 45. I found too many black men with prostate cancer before they turn 45. So you want to get your PSA annually starting at age 40. Now, what I always recommend is remember the month. My month is August. When August starts coming around, I just get anxious because I don't know what that PSA is going to show. So remember your month. If your month is February, then you got to go in February and get it. I suggest that you not do it in February. That was supposed to be a joke, but anyway. All right, but so make sure that you get your PSA annually, okay? You also, if there's any number you want to pay attention to the number that the doctor gives you. Just don't let him say, well, it's all right. You want to know, what's that number, doc? Okay? Because it's the number that we pay attention to. When the number begins to rise, then it sends up a flag that something may be going on, especially if the number doubles. If you come to me and you're 40, you come back and your PSA is 1. By the way, 0 to 4 is the normal range. But if you come to me and your PSA is 1, then you come back to me the next year and your PSA is 2, even though it's normal, I'm going to send you for additional workup because that means that something is going on. It's a red flag that something is going on. And I cannot tell you how many times I have picked up on prostate cancer early because the number doubled, okay? Now, if you have a family history of prostate cancer, family history means that your daddy may have had prostate cancer, his brother, your uncle may have had it, grandfather may have had it. That means that you have a family history, and so you need to tell the doctor that. If you have a family history, particularly a first-degree family history, and you're not even 40 yet, I may start checking your PSA when you're 35. Okay? Now, here's the other thing that we must do as African American men. We must not continue to be secretive with our sons and our daughters about our health. I saw a man a couple of months ago, for the first time, we diagnosed prostate cancer on him. He had his last PSA was 3 years ago. He switched doctors. And so we sent him to the medical university. They did the biopsies. The biopsies came back positive, and he had to have a prostatectomy. He has 6 sons, because I'd asked him about his family history. So I asked him when he came back, I said, well, I know you've discussed this with your sons. So he said, no. So I said, well, why? He said, well, because it's not none of their business. Wow. So I asked him, I said, so if you had walked a path and you knew around the bend there was danger, and you walked that path a lot of times, and you knew your son was going to have to walk that path too, would you not want to alert your son that there's danger around the corner? He didn't say anything. Next month he came back, told me that he got in contact with all of his sons, told him that he had prostate cancer and that they needed to be evaluated, okay? That is the mindset that we as African American men must adopt in 2016. We cannot be secretive about our health. You have to share that information with your daughter and your son, because now we have some early information that there may be a relationship between prostate cancer and breast cancer. If you've been keeping up with the literature, we don't quite have it worked out yet, but we think that there may be a relationship, okay? So as African American men, historically, we like to keep things secret. We don't like to talk about our illnesses to our family, but this is 2016. You got much more information. You want to share that information with your family so that they will know to tell their doctor to be on the lookout for it. All right, so back to PSA. So you should know what the PSA is year to year. Now, the PSA does not make the diagnosis of prostate cancer. It just only tells us that something is going on. So you can have an elevated PSA, go have the biopsy, and the doctor may not find anything. But he will tell you, I want to keep you under observation. Now, that doesn't mean that keeping you under observation means that I want to see you every 6 months and we want to continue checking it. Keeping you under observation means that, bye-bye, I ain't going back there no more because I don't have it. That's not what the doctor said. I cannot tell you the number of times that black men will hear that. The doctor said, come back in 6 months. They go back in 6 years. Prostate cancer is now in stage 4. Okay? So you gotta stay on top of it. You gotta stay on top of it. Now, I don't too much talk about the symptoms of prostate cancer. And the reason that I don't is because 90% of the men that I see who get diagnosed with prostate cancer don't have no symptoms. We are able to pick up on it before the symptoms occur. Now, the symptoms are dramatic. The symptoms are seeing blood in your urine, not being able to get an erection, pain on urination, okay? But those are late symptoms, all right? We want to catch you early when you're not having any symptoms. New information. We now know that there's a relationship between prostate cancer and being significantly overweight. We haven't quite worked it out, but we are seeing that there's a correlation. We also know that there's a correlation in prostate cancer and low vitamin D level. Now, that doesn't mean you should go out and start taking vitamin D, because I said a correlation, okay? We know that you can decrease your risk of prostate problems in general if you have good sex on a regular basis. Yeah, I thought that would get your attention. I'm just kidding. Having sex on a regular basis increases the health of the prostate. Doesn't keep you from having prostate cancer, but it makes sure that the prostate works. How many of you know what the prostate does? We talk about the prostate all the time. Is there anybody in here who knows what the prostate does? Never thought about. God gave it to us for a reason. No, not produce sperm, but it produces the fluid that the sperm comes out in. Okay? That's what the prostate does. The prostate supplies the secretion. Prostate is like, if you want to feel what a normal prostate feels like, if you take your finger and rub it across here, this is what I'm looking for when I feel your prostate. If you see, it feels very, very spongy, very, very spongy. All right, when it feels hard and lumpy, that means something is going on. And by the way, that's why getting your prostate examined yearly or every other year is very, very important. The rectal exam is very, very important. So the PSA and the rectal exam is very, very important. You should get that annually, okay? But an enlarged prostate, it's a natural phenomenon. Hopefully, it doesn't grow so fast to cause you to have issues emptying your bladder, getting up, going to the bathroom 2 or 3 times a night. There's no relationship between an enlarged prostate and prostate cancer, like some people think. There's not a relationship there. You can have what we call benign prostate hypertrophy. That means an enlarged prostate, but it does not mean that you have prostate cancer. It's not in the succession of symptoms toward prostate cancer, okay? But if you have an enlarged prostate, medications can be given for that. By the way, the prostate is a gland that it looks like a little, think of a saddlebag sitting over a pipe. And as you grow older, the saddlebag gets bigger and it squeezes the pipe that goes in the middle, and it causes you to have symptoms. So usually if you see a guy, if you're in the urine and you see you standing there and taking a whiz and the guy just standing there, old man just standing there waiting, well, he probably has a little BPH, and you just have to be thankful because in time you'll probably have that too, okay? So it's gonna happen to all of us, all right? By the way, you've seen that commercial about Cialis? Yeah. Okay, you've seen the commercial about Cialis. Well, what we've recently found is that if you take 5 milligrams of Cialis, not only will it help you get an erection when you need to, but it will also help relax the prostate so that you won't have symptoms of BPH. And in fact, the drug company promotes it like that. And oftentimes, I have a lot of patients who, they don't never miss their prostate medicine. I had one guy say, "Doc, that prostate medicine is something else. It also works good for other stuff too." Okay? I think the thing that you need to know, that you know, this whole session could have just been on the prostate. So I'm going to tell you a couple of other things, and then I'm going to move on. Prostatectomy is a treatment modality that you can consider. When you go to see the urologist, he will give you several options, and he will tell you what the outcome of each one of those options are. One option could be, we're not going to do anything, we're just going to wait and see. That's a legitimate option. The next option is we need to do a prostatectomy where we need to take it out. The next option is we need to do radiation. We need to do seeds. So when you go to the doctor, he's going to have a lot of additional information. And based on that information, you and the doctor will make a decision as to what is best for you. Now, if you're not sure what is best for you, then go back and talk to your primary care doctor. Here's a mistake that African American men make that we should not make. If you have to go to the doctor, please take your wife with you. Amen. All right? You cannot hide that information. All right? Is it going to affect your manhood? Yeah, it may affect your manhood a little bit, but you got to take your wife with you. All right? Because one of the things that I found out is oftentimes you are so anxious when the doctor is talking to you, you're not going to hear all the things. And when you get home and y'all start discussing it, you're not going to hear the same thing that she hears. So she needs to be aware of what's going on with you. Now, I tell you that because a lot of us never share that information with our better half. And by the same token, I can tell you that a lot of women get diagnosed with breast cancer and they never tell their husbands that they're getting treated. That's another subject altogether. So we do need to share that information with our better half. Okay? So go to the doctor. Just because your friend had one thing done for him, that doesn't mean you're okay? Yes, a B in here, yeah. Just because your friend had one thing done, it doesn't mean that you need to have that same thing done because everybody's situation is different.